that today that Africa is nearing 300,000 cases. I just wondered, I mean, how much do you think that's an underestimate? And do you think that Africa could be the next hotspot? We've seen it's obviously focused in Latin America and North America at the moment, but are you concerned that that might shift in the coming months?
Here? Yeah, that on? It is. Okay. Yeah, I think the situation in Africa is mixed, and I think Africa is a very large continent, both in sub-Saharan sense and North Africa, which are in two different WHO regions. But you know, we've seen increases of disease in some countries in excess of 50% in the last week, and we've seen other countries with very, very stable numbers. But in general, the numbers are on the rise. In Africa, we've seen large increases in places like South Africa. We've seen increases in places like Benin, in Eritrea, in Ethiopia, in Burundi. What we haven't seen yet are large increases in the number of deaths. So Africa, at this point, is still avoiding the large proportion of deaths that have been associated with this disease in other continents. Now, there are important caveats here. Testing is not as frequent in Africa, so there clearly could be underreporting of cases. Hospitals do not appear in most countries to be overwhelmed, but in certain countries, like in Nigeria and in heavily populated areas like Lagos, hospitals have come under significant pressure. So I would say the situation in Africa in general is very mixed. It very much depends on the context in which people are living. Larger cities seem to be more affected. We've seen outbreaks in refugee camps. We've seen, as I said, increases in cases in a number of different settings. Will Africa be the next epicenter for this pandemic? I certainly hope not, because the health systems in Africa in general are weaker than in other parts of the world. Populations, while they have the benefit of an age profile that's much younger, there are many people with underlying conditions. There are many, many vulnerable people. And we need to try and keep these numbers as low as possible, while at the same time making sure that the lives and livelihoods are protected. And this is a constant challenge. So there is no room for complacency on the African continent. This is a time to really focus in on improving surveillance, really focus in on improving the capacity of healthcare to treat cases, and to focus in on some of those countries that are experiencing quite large increases of cases. And our African Regional Office, our Eastern Mediterranean Office, continue to work with those countries. And we have WHO offices in all of the countries in Africa, and will continue to work closely with governments there, both to suppress transmission and to reduce case fatality where that is a problem.